So tell me a little bit about your background. I guess you started off wanting to be a pediatrician. You used to watch the Cosby Show. So you wanted to be a medical doctor. Your mother said you had the hands of a surgeon.
Yeah.
That was kind of funny. So tell me.
Yeah, that's very interesting. I know exactly where she got that from, but she definitely implanted that idea in me. And so, going through high school, I was a Boy Scout, and through that organization, was able to do a program called the Medical Explorers. And from that, I was able to go in the hospital, volunteer, and just fell in love with helping people and doing for people and understanding those things. And so, got to right before medical school, I thought I'm going to be this pediatrician. When I worked at an ER, a pediatric ER, and so the pediatricians would come down and they would be thinking about things in their mind, and so like I'd ask them a question about this X-ray, and they kind of looked at me like, we're a million miles down the road, and you want to know about this X-ray? Whereas when the general surgeons or the orthopedic surgeons would come down, there was something that I could see. It was very tangible to me, like, okay, this bone is out of place, or this needs to be repaired or sewed up. And so I fell in love with,
like, it was more predictable of outcomes.
Yeah, more predictable of outcome, and I could see it. It was something that I could affect right then and there. And orthopedics is kind of like working in your shop and getting people, but you're just doing it on humans, making them better. And so that's where my love of orthopedics started.
First doctor in your family?
First doctor in my family, yes.
Where'd you go to school?
Yeah, so I went to college at a small school, Freed-Hardeman University in Henderson, Tennessee. I then went to medical school at the University of Tennessee, which is in Memphis. I then did residency down in Augusta, Georgia. They play a little golf down there.
Okay.
Left there and was very fortunate to do fellowship in Boston at New England Baptist Hospital. So after medical school, went to residency, and that's as far as learning orthopedic surgery, and fell in love with doing sports surgery as far as arthroscopy of the shoulder, the knee, rotator cuff repairs, ACL reconstructions, labor work, meniscus work. And like I said, I was very fortunate to go to Boston. Went to New England Baptist Hospital, and it was there that not only did I learn a lot of surgery, because we did a ton of surgery, but it was there that the regenerative medicine piece started for me.
The stem cell stuff.
The stem cell, yeah. So stem cells and platelet-rich plasma. Because the guys there that played for the Celtics wanted that. The attendings that were teaching me offered it to their other patients, not just the athletes. And so that's where things started for me. And then I went into practice on my own. And there was a couple of key patients that I saw along the way that really solidified those things for me. A patient that was dealing with Achilles tendonitis. He was a big time runner, wanted to get back to running. He had seen 2 to 3 other orthopedic surgeons, been put in a boot to help treat that, seen physical therapy, not getting better. Treated him with those things and
with stem cells.
With actually with that patient we treated him with platelet-rich plasma, and that's where those things started for me. And then so just as the days went by and the months, and treating more people and understanding, okay, this really helps people without doing surgery. Has led me to this point that I still operate as far as doing those certain cases, but a lot of what I do, actually most of what I do, is stem cells and PRP, platelet-rich plasma, and trying to keep people out of the OR.
Boston Celtics. Mm-hmm. You were one of the team physicians.
Yes.
So basically, you were doing this on these professional athletes,
right,
on their knees, on their shoulders, things like that, on their ankles, whatever, and then you started doing it on regular people.
Correct.
Getting the similar results.
Yes.
And that's what brings you today.
Yep.
And now, I guess, is your challenge just getting people to believe it? Because I know insurance doesn't necessarily cover it. Is that the challenge, to get people to just buy into it?
Yeah, it's education, and getting people to understand how this can help, and hey, you don't need a surgery. Sometimes there's not a surgery for that patient. And so, once again, we love how we do it. We love to educate people about the options that are out there. And this is a very, very good option to help keep people out of the operating room. And more than that, to help people, feel good, right? Because when their inflammation is down, their pain's down, then their function's better.
Do you see people every day or every week that have avoided surgery with these regenerative therapies, as you call them?
Right, yeah, every day.
Injectable? Really?
Every day.
Like they're saying, I was told I need surgery, I want a second opinion.
That's a common story. They were told that they need that, they don't want to do that, or they're not ready to do that just yet, and then they're saying, okay, there's got to be some other option out there. What else can we do? And that's when they go looking for us, and or a friend or a family member says, hey, you should check out to these guys. And then so they come in and we take them through that process. And then especially if we do a procedure for them, they're usually very happy that they had it done. And that's what they say all the time.
Are people traveling to see you?
They do.
Because not a lot of guys doing this, right? Not a lot of orthopedic surgeons, percentage-wise, are doing this.
Right. So I'm there in Nashville, Tennessee, and definitely, the 8 surrounding states of Tennessee. We have lots of folks that come to see us. Athletes have been other places, right? Parts of the country, and they fly in to see us. So people are definitely coming to see us.
So you have kind of like, I'm calling it a secret cocktail, if you will, of both their own stem cells from their bone marrow, and maybe like this prolotherapy. You say it's like sugar water.
Yeah.
And also with platelet-rich plasma,
Correct.
which is growth factors.
Correct.
So is it usually those 3 things together, combination for knees and shoulders and things like that?
Yeah, usually those things. It depends on what we're treating, how we're treating it. But yeah, we've done this long enough that we understand. Okay, it needs to be this concentration, or we need to have this much of it. And with our lab platform the way it is, we can dial those things in specific to that patient. And so
big learning curve to this?
It was, and I'm still learning. It's so much fun. I enjoy how we do it, what we do, and
the results you're getting today are far much better than just 3 years ago.
Oh yeah. It's a great time, and like I said, and to do it without having to do surgery, it's fun.